One potential side benefit of Botox was discovered accidentally when Botox was undergoing studies for cosmetic use. Some of the patients receiving Botox in these studies began to comment that their migraine headaches seemed to be cured or improved by Botox injections. A number of physicians performed small studies on the use of Botox for migraine, and some found it to be effective and others did not find it to be more effective than placebo for the treatment of migraine headaches. Use of Botox for the treatment of migraines is what is called an off-label use because the FDA has not yet approved Botox for the treatment of migraine headaches. Botox is in the final phase of studies with the FDA, but this is a long process and it's even possible that the FDA will require further investigation of the drug before it gets approved for this use. The mechanism by which Botox alleviates migraine headaches is not yet proven, but it is now believed by many that Botox can reduce the severity of migraines by relaxing muscle tension that can trigger the headaches or by breaking the muscle spasm pain cycle that prolongs the headaches. Botox is also known to block release of some chemicals from the nervous system that transmit pain, and some believe the blocking of these chemicals may play a role in relief of migraine pain by those who use Botox. So how Botox works, and even if Botox is effective for the treatment of migraines, headaches, is really somewhat controversial. Just the same, I think it is important to identify patients who can benefit from Botox therapy because migraine headache sufferers are so common, because migraine headaches cause people to miss so many days of work and days of their life. And also because many people simply don't respond to first-line therapy for migraine headaches. I also have to say that at a couple of different levels, my own personal experience with Botox for the treatment of migraine headaches has been very positive. First of all, I suffer from headaches, and when I first started to use Botox for the treatment of forehead wrinkles, I noted improvement in my own headaches. I continue to use Botox in part because I don't like the wrinkles, but also because I don't like the headaches, and I found that Botox alleviates my headaches. So I believe Botox has helped my own headaches. Second, I have treated quite a few migraine sufferers in my practice. Those who I have worked with have been a fairly treatment-resistant group. Most have tried 2 or more migraine therapies and discontinued use either because they did not find these first-line treatments to be effective or because they found the side effects to be such great. They had side effects such as stomach upset, weight gain, and drowsiness. I have also mostly limited treatment to those who have a fairly well-defined trigger point in the front of the face. The most common triggers areas are between the eyebrows, in the forehead, and along the temple line. Treatment consists of injections of approximately 50 units of Botox directly into these trigger areas after numbing with topical anesthetic. Despite the fact that I have worked with a fairly treatment-resistant group, the majority of patients have received relief of migraines. Most have found the treatment beneficial enough that most have come back for more injections. Side effects have included an occasional bruise and loss of wrinkles in the area that's injected, which is usually desirable for most patients. Patients have not had the kinds of side effects they suffered with other migraine treatments, so in addition to helping me with my headaches, I believe that Botox has helped the majority of patients I have treated for migraine headaches. To be frank, the limiting factor for most patients with migraines is the cost of Botox. Some insurance companies will pay for Botox injections to treat migraines, but many will not. Most require that you have tried and failed treatment with several mainline therapies for migraine. The Center for Facial Appearances is a top user of Botox in Salt Lake City, Utah, and in the Mountain Time Zone. In addition to using Botox for cosmetic purposes, we are a top user of Botox for medical conditions such as blepharospasm, hemifacial spasm, and migraine headaches. We are glad to assist you in any way possible to work with insurance companies that cover this condition. For those who do not have insurance coverage, we reduce our per unit charge by 25% in order to help as much as possible to make the treatment affordable for you. I hope you have found this video useful. If you have questions not answered in the video, or if you're ready to schedule a consultation at the Center for Facial Appearances, please do not hesitate to call us at 801-363-3355. Thanks.